1 or 2 minutes before, so everyone could join and tune in. And with that being said, it's now 11:02 here in Winnipeg, and we will get started.
All right, welcome everybody. Today we're going to do a session on searching for health information. I'm Gail Matheson. I am a MHIKNET librarian, and Orby Dingwall is here today as well, and we will start the session. So the first thing that I want to do is our land acknowledgement. So the University of Manitoba campuses are located on original lands of Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and on the homeland of the Métis Nation. We respect the treaties that were made on these territories. We acknowledge the harms and mistakes of the past, and we dedicate ourselves to move forward in partnership with Indigenous communities in a spirit of reconciliation and collaboration. So in today's session, we're going to talk about the 4 primary MHIKNET library services that we have to offer for anybody who isn't familiar with MHIKNET. Then we will describe the 5 steps for finding health information. And then we will talk about how to choose resources based on your information needs. So MHIKNET is Manitoba Health Information Knowledge Network. And we are associated with University of Manitoba Health Sciences Libraries, and we provide library service to staff of Manitoba Health, fee-for-service physicians in Manitoba, and staff of participating regional health authorities. So this is our MHIKNET team. So Orby is the head of outreach services, and then I, Gail Matheson, am a MHIKNET librarian, and then Cheryl is also on our team, and she is usually the person that you will receive emails from if you email our MHIKNET email address, and she'll be sending you full text articles and things like that. So your MHIKNET library card, it's very easy to register for one of our cards. They are free. You just have to go to our website and fill out a registration form. And then you can either email it or fax it to us, and we will get you set up. You just have to include an image of your staff ID with it. Then we will get you set up with your library account. So the services that we offer a literature search service. So if you have a research question and you want us to do the searching for you, we can do that. Go through different databases that we have access to through the University of Manitoba Libraries. We will send you a reference list. And then from that reference list, you can let us know if you want any of the full text articles. Then we have document delivery. So with document delivery, we can send you the full text of any citation that you may have found. Maybe you were doing a search and you hit a paywall. You can send that citation information to us and we will get you the full text. Don't pay for it, don't go through that paywall. We will get it to you for free. And then we also have a current awareness service. So if you have a particular topic or a journal that you really like or a favorite author, we can set up an alert so that you will receive a weekly email with the newest things that have been published in those particular areas. We also have education and orientation sessions like the one we're doing today. We have a number of webinars on our website that you can access for free. We will also do one-on-one sessions, or if you want to have a group or maybe your team wants some instruction on a database or reference management software, or a session like today, searching for health information, we can absolutely do that for you, and we can do it online or in person. And we also will provide direct access to up-to-date, and Orby will talk a little bit about that later today and show you up-to-date. But with your MHIKNET library card, you can get access to that. So right into the 5 steps for finding health information. So the first step is just asking your question, figuring out what that question is that you want to do your research on. And it can be something fairly simple. You start off with maybe this example: should pregnant women take vitamin D supplements? So then from here, we can look at a few different models to help us flush out and create that question a little bit more complex. So we can use either the PICO model or the SPICE model. So PICO, we can add in population, intervention, comparison, and outcome, or we can look at it from SPICE model: setting, perspective, intervention, comparison, and evaluation. Today we'll use the PICO model to help flush out that question. So we can make it a little bit more complex by saying, do oral supplements with vitamin D alone or in combination with calcium given to women during pregnancy improve maternal and neonatal outcomes? So adding in that comparison of calcium and then thinking about the outcomes. So if we break that down into that PICO model, for population, we get pregnant women; intervention, we get vitamin D alone; with comparison, vitamin D with calcium; and then outcome, maternal and neonatal outcomes. So then the next step after you've constructed that question is to think about your search strategy. And as you develop that search strategy, you're going to start maybe with a word map like this. And you're going to start, so across the top, we have those PICO elements: our population, intervention, outcome. And then what we want to do with each of those areas, we want to think about different synonyms, different terms that maybe mean the same thing, and maybe different spellings for American versus Canadian, and try and get a good sense for that particular topic. And then you can see the or across the side and the and across the top. So as you create your search strategy and put all those terms together, you're going to put an and between all of your PICO elements. And then when you're looking at those various words, you're going to add in the or there between those terms, so that it's going to pull out results that use maybe pregnant or pregnancy or prenatal. And you're going to get everything in that particular area. So across the bottom here, I have written out that search strategy in an example using brackets to keep those PICO elements together and using quotations for vitamin D to keep the phrase together, just as an example. So then I'm going to pass it over to Orvi to talk about identifying the best sources.
Okay, thanks so much, Gail. I'm going to take over the screen share now. And Gail, you'll be in charge of the chat. So once you've sort of thought through exactly what you're looking for, then you need to identify where you're going to start doing your searches. So I'm going to launch a poll, and just to ask you where you currently look for health information. So the poll should automatically pop up. And if it doesn't, you should just be able to click on your Zoom taskbar and then it should pop up. But some of you have started participating. So that means some of you have found the poll at least. So that's great. I'll just give you a couple more seconds. There's no right or wrong answer here. This is just for to help you start thinking about what your current practice is, and also for us to just understand maybe what you're already familiar with. Okay, so I'm going to end the poll and I'll share the results. So many of you are going to Google first, which is just fine. Some going to UpToDate, clinical practice guidelines, or maybe some internal policies and procedures. So you're already maybe familiar with some of the resources that we'll cover today. The first one I wanted to mention is about UpToDate, which is a clinical decision support tool. It's got all kinds of things. And I mentioned in the chat, but I'll also mention aloud that we will be sharing the slides from today. So some of this information then you might want to read through later. UpToDate has been available all across the province since January of 2016. So anyone listed here, fee-for-service physicians, anyone affiliated with the university, everyone working at regional health authorities and Manitoba Health. And we'll have to change that name because there's been a name change since then. You all have access to UpToDate. So what I'm going to do, I'm going to just stop sharing that slide and I'm going to take you live to UpToDate. And if you just give me 1 second here, I'm just going to, there we go. And so this is our MHIKNET website, and Gail might just want to pop in into the chat, www.mynet.ca, and you can just click right in the middle on UpToDate. And and it's prompted me to log in. So I didn't have that here. I thought I was being so savvy and having it ready to go. Oops. Oh my goodness gracious. This always happens when we thought I was all prepared and then of course not. Okay, so I'm going to log in from here thinking this was a faster way to log in. It was not. Okay, so here we are in UpToDate. I'll zoom in a little bit for you. I'm logged into my account, and UpToDate is a really great place to start with really clinical questions. And so this is a great example. You just type in comments like you do, or type in search queries like you do in Google. So just pregnancy, vitamin D, here's the first hit, nutrition in pregnancy. So I could include something more comprehensive, like what Gail was outlining, thinking about pregnancy or pregnant or perinatal. But UpToDate will give you, will understand whether you're using really common language, really technical language. And so it's really easy to use. On the left-hand side, there's sort of a table of contents of what's going on, or I can just scroll through on the right side. But what I saw over on the left was information about micronutrients, specific about calcium and vitamin D. I'll scroll down some more and it tells me here about vitamin D, gives me a really short summary. It tends to be quite written in quite a clinical language, which may or may not be what you're looking for. And then there's references and I can see additional UpToDate information. And so basically what the summary here says is that, well, anyway, is that depending on what part of the world you're in and what your diet looks like, depends on whether there is evidence to support you taking a vitamin D supplement. So that's really, really quick and really concise. But if I'm looking for some, and I apologize if you can hear my dogs barking, we can also go to PubMed, which is going to give us all kinds of information. And this is when it's going to be helpful to use a sort of, we'll call it a fancy search string, sort of like what Gail was talking about in that search map. So I'm going to say vitamin D. I'm going to use and, that's called the Boolean operator. I'm going to put in different words for pregnancy. UpToDate already has a query running so that it will know when you search for pregnancy that you're also looking for pregnant, prenatal, perinatal. PubMed is only going to search exactly what you tell it to search. So there are pros and cons of both ways. Librarians like to be in control of what we're searching for, and you might too in this instance. So just a quick demonstration of in PubMed. You can see here, it tells me how many results I got. I got 3,064 results. On the left-hand side, I can start applying filters. So if I am only interested in more recent things, I can toggle to have things that are more up-to-date. I could limit to different types of articles, different publication types. I can add in additional filters if I'm interested in different languages or different types of articles. And then here in the middle of the page, it gives me all of the different results, including the title of the article, who the authors are, the journal that it's located in, and a summary of the information. And so that is your really quick overview of what a PubMed result looks like. I could have also just popped in vitamin D and pregnancy and hit enter or clicked return. I'm getting more results here though. And so there are more results to filter through. So if you haven't searched PubMed or you haven't searched PubMed recently, give it a go, give it a try. And some articles you can add the filter for just free text. Some articles are available free text, but if ever you find something in PubMed or anywhere you're searching and you would like to have the full text, but it tells you you can only have that if you pay $80 or some insane fee, don't ever do that. Just copy the citation. So you could even just like grab all of this, hit copy, and email it to MHIKNET@umanitoba.ca, and we'll send you the full text. So that's one of the things we're here for. And so that's a really quick overview of PubMed. And so if when I was in UpToDate, if it told me like only, there's all kinds of different levels of evidence for talking about pregnancy and vitamin D, and you were like, I would like to know about all of those, then you can go to PubMed and it will give you more. If you're still in search of something like really definitive, like what do we recommend here in Canada about vitamin D? We can also look to clinical practice guidelines. And so these are statements or recommendations intended to optimize patient care that are informed by really large bodies of evidence. And so one great place to look is the Canadian Medical Association. They have a platform called Jewel. Their clinical practice guidelines are available for free. And it's great to search places here. Again, something that's really clinical and something that that research is already available on the topic. For those things that Google tells you there's so much, clinical practice guidelines really help distill it into single recommendations. So again, really easy search here. I can just do vitamin D pregnancy. It tells me there's nothing. What about if I do pregnant? I thought it told me something. Oh my goodness gracious. Okay, so it's telling me I'm getting nothing. So I can just search on vitamin D and I see there's 14. Again, on the left-hand side, there's filters. So if I don't speak French, and you'll see that there are some French articles here, or if I prefer French and I don't want the English ones, then I can pop on those English or those language limits to just have it display the language that I want. And then you can click into here and see what they're talking about. I might also look, so there's 14 clinical practice guidelines on vitamin D. I might look to pregnancy, lots about pregnancy, so there's 230. If I'm interested in more international guidelines, I can come to the TRIP database. And again, we'll send you the slides and a handout so that when you're like, oh, I need to know about clinical practice guidelines on this topic, what was that resource that Orby and Gail were telling us about? We'll make sure you can remember. So again, here I can go vitamin D, pregnancy, click return. You can get fancier in this database, but you don't have to. It can be easy. And right here, you can see there's on the left, there's different filters that you can use. So if you're interested in these Canadian guidelines, you can come here. What was I doing earlier? Oh, if I might add some, I might put vitamin D in quotations, and that might change my results slightly. It brought the number of results down. So I'm looking at how many guidelines we have. In Canada, there's 24. So I can come to these. if I would, or I could limit to Australia, New Zealand, or the US. So it's really user friendly. If you're, again, for these clinical questions, you can just pop them in and give it a try. And there's no harm in finding out and just popping in some terms and playing around a little bit to see if what you're interested in is going to be available here. Okay, it's back to you now, Gail, right? To talk about Google. I'll stop my share. I think she's just unmuting.
Yes, sorry. Okay, you should be able to see my slides now. So I'll talk about Google. So Google has a ton of information indexed in it. When's the best time to search in Google? It's if you want to just get a sense for a topic, you're working on that word map that we talked about before, just starting, trying to find some terms, it can help you do that. If you haven't been successful searching other places, because there is so much information indexed in Google, it's a great place to look after you've exhausted other places. If you want to see what your patients are reading or what the general public are reading, you can get that sense from Google. And if you're looking for gray literature, so this is what I will use Google the most for, is if I'm looking for documents that haven't been published through those normal channels, maybe they're government documents, maybe they're association reports that are sitting on their website in a PDF, you can find those through a Google search. So some tips for Google. The Google algorithm will use a lot of different things to generate your search results. So keeping in mind that it's thinking about where you're located when you're searching. So if you're in Canada, it's going to try and rank Canadian sources maybe higher than others. It's going to look at your past search history. So if you've been searching for, say, pregnancy a lot, you may get different results than, say, if you've been searching for other kinds of documents. Maybe you've been focused on tuberculosis. You're gonna get different results. So sometimes what I'll do is I'll switch my browser. I'll move from Google Chrome to maybe Firefox, and I'll get different results. It's one of the challenges with Google is it's really hard to reconstruct your search because it's pulling those different elements into its algorithm. So you and your colleagues may get very different results with the exact same Google search. Then you can think about some of these tips for when you're constructing that search strategy in the search box. So Google isn't case sensitive. It will do the same thing for capitalization versus not. It will rank your terms. So the first term that you put into your search is going to be the most important. You can play around with that order as you're searching, but keep that in mind. You can get different results depending on what you put first in that search. Quotations will keep a phrase together. So for vitamin D, it will keep those terms together. Spelling, Google will interpret the words that you're using and the spelling. So it will pull in all the synonyms. So you don't have to necessarily use the or terms, that Boolean operator or, and it will look for prenatal, pregnancy, pregnant, with just using maybe pregnant as a term. You can omit non-essential terms, so just focus on those main keywords. Think about writing answers instead of asking questions. And then as you're screening your results, you'll move quickly through the results and kind of look for the sources. So I'm just going to move to Google here. And just kind of show you
And
a
maybe
search.
Gail, if you can just zoom in your Google screen a little.
Yes, I absolutely can do that. Okay. So as I'm searching through, I'm not really looking at the titles. I'm looking at the authority. I'm looking at the URL. So National Health Service, UK. Here's a PubMed article, some Government of BC information. You can quickly scroll through things and screen things that you maybe don't want to look at. There's JAMA, another maybe good one, World Health Organization, Cochrane. So I'm moving really quickly through the results, and I'll usually maybe stop searching once or stop clicking through pages once I notice that there isn't really very good stuff. Or if I notice that there isn't what I'm looking for in the results, then maybe I'll go back up and I'll rework some of my keywords. Maybe I'll add something else in there. You can also adjust your search using the tools here. So if you only want things from the past few years, you can add in a date and it will restrict. You can also go into the advanced search here, that little tool there, and you can get to the advanced search options. So you can see how it's breaking down your search. And if you scroll down, you can get to this site or domain. And I really like it because you can start to target search. So if there's an association that you really are interested in, so ITK is an Inuit organization, we can try searching and see what we get from that organization. So we get 4 results. So very quickly we can see what they have published on that. We can go back quickly and we can try the National Collaborating Center for Indigenous Health. See what they have, and they have 20 results. You can also change it up here in the search string and quickly try something like the World Health Organization, pop in the URL, and then you can see what they've published. So that will help you target a few different things. Go back to okay, and then last kind of tip is thinking about using medical terminology versus layperson terminology when you're doing your search. So maybe if you want some patient information resources, you could use layperson terminology. If you want more medical resources, guidelines, you can use medical terminology and you can get different results trying those different things out. So the difference between Google and Google Scholar, Google will index websites and links, whereas Google Scholar will be indexing scholarly sources. So articles, theses, books, abstracts, court opinions, and it's searching academic publishers. So things that have been published formally, professional societies, looking at online repositories and universities. I will just pop back out and just show you Google Scholar. Do that same search. So you get very different results. So it's sort of similar to PubMed in that it has your article title, your authors.
Sorry, Gail, can you just zoom in again?
Oh, zoom in. Sorry. Yeah, absolutely. There. So title, authors, little bit of an abstract there. You have ways that you can limit. So you can limit down by a date if you want. You also have some advanced search options in Google Scholar. If you go here, those lines, advanced search, so you can put a keyword in for a journal title if you want. You can play with the date, and you can kind of customize your search a little bit there. Google also does some nice things with helping you dig a little bit deeper into other articles. So maybe you find one that you're really interested in, or maybe you have another resource that you found in PubMed that you really like. You can search for it in Google Scholar, and it will pull out articles. So it's found a number of different articles that have cited this particular article. And if we click in here, it will give you a list, so you can kind of look through and see if anything there is interesting. For some authors, you can click in and it will show you other things that they have published. So you can move through information a little bit differently if you want. I will move back to the presentation. So experiment, don't be afraid to try different terms, keep adding to that word list as you go, adding new things, explore. You never know where one thing may take you. And at any point you say, oh my goodness, I don't want to do this search anymore. I want a librarian to do it for me. We are happy to do that. You just email us, send us that search, and we will look through the databases for you. And we have access to some databases that you may not have access to through the University of Manitoba library subscriptions. So we can try and do a comprehensive search for you, and we will send you a list of references. And I will pass it back to Orvi for critical appraisal.
Okay, thanks. I'm gonna take back over the power of the screen share here. And so critical appraisal is a really important one. Some sources are more authoritative than others. So certainly the information in UpToDate and PubMed is more trustworthy than what you might find on Google. But even what's included in UpToDate and on PubMed, still worthy of critical appraisal as well. Oh, I was going to also mention and it might depend on the kinds of information you're looking for as well in where you're going to search. So like we said, clinical is really important to go to UpToDate and clinical practice guidelines. If you're looking for patient resources or images or handouts, things like that, Google might be a really great place. And PubMed is really a great resource if it is health related, but not necessarily purely clinical. So it might be about how can you offer education programs to pregnant women. UpToDate is not going to have, or clinical practice guidelines are not going to be the right places for that, but PubMed and maybe even Google are. So when you're in the wild depths of the internet, critical appraisal, really important, right? And really what you're looking at is, are the methods in the study used? Are they good enough that I can feel confident in the findings? So methods are an important part. You might also look at who the author is, who the authority is. So we have some quick resources to help you answer those things quickly. My favorite is the CRAP test because I like acronyms, and CRAP is an easy one to remember. Like, is this crap or is it good? So is it current? Is it reliable? Is it authoritative? And what is the purpose or the point of view of this? So when we're searching about prenatal vitamins, is the information coming from a vitamin company and are they trying to sell it to me? Or is this from an international organization that is really trying to better the health of women and newborn babies? And depending on what you're searching for, currency will mean different things. At the start of the COVID-19 pandemic, when we were current meant like in the last 6 hours on, giving vitamins to pregnant women, the last 6 years might be current enough. So that's a really quick in your head when you find something and you're thinking like, can I incorporate this into my practice? Can I use this? You can think of current, reliable, authoritative, and purpose and point of view. Another one, and we can pop the link in the, we'll pop the link in the chat as well. This is from the International Federation of Library Associations. It might be something that you might want to print and have on your bulletin board. And it's about how to spot fake news, but it's also relevant for just a quick guideline in a quick critical appraisal. So who is the source? Who is the author? What is the date? Is this a biased perspective? I was searching earlier today about mask mandates, and there's some literature coming out saying absolutely they were not effective, they didn't do anything. And I want to be very careful about taking that for granted, and I'm going to dig into the biases of the authors and the publisher on that one before I just make an assumption about it. Oh yeah, also important to know, is this a joke? Was it meant to be funny? Or is it meant to be authoritative? So these two really, they're just quick to do and just to have thinking in the back of your head as you're going through something. If you really want to go deep and say, okay, I've got this, systematic review that's telling me to change my practice on giving vitamin D to pregnant women, you might want to do a more robust critical appraisal. And the place to do, and I'm just going to make sure, Gail, now you can see the CASP site. I just want to make sure that came through. Yeah, she's nodding. Okay. And so this is a really great evidence. It's a critical appraisal skills program. They offer training and education on how to be better at doing a more formal critical appraisal, but you can also go to their checklists. And I just clicked on one of the first ones there just to give an example of what they have. So this is the one about randomized controlled trials. It gets pretty text heavy at the beginning to give you an introduction, and it tells how it was designed and how it's intended to be used. But then it has this really nice checklist that just says, did the study address a clearly focused research question? And then it gives you some things to consider. And you can then enter yes, no, or you can't tell. Was the assignment of participants to interventions randomized, etc. And it goes through like this. And at the end, it's not going to calculate a score that says like, yes, this was a high enough score, you can absolutely trust this. It just helps you, again, consider based on what they've done, can you rely on this for the considerations in your population or in your clinical work? So that is CAS. And yeah, so some easy ones like CRAP or a nice infographic to things that are hugely technical. So in summary, we've got really 5 steps for finding health information. So you ask your question, and then you create your effective search strategy. And you saw us flip between those search strategies based on the resource we were using. And again, we're hoping that we're giving you some options and maybe introducing some new resources that you can try out. And don't be scared to just, pop in some questions and poke around a little bit. You might find exactly what you're looking for, or you might develop your search skills some more. Or you might just say, wow, there is like so much on this and it is hard to find what I'm looking for. I'm going to message Orvi and Gail, and they're going to do the search for me. And there's lots of different sources that are freely available for you to use. So hopefully today we've given you some ideas about where to go for different kinds of information. Then you actually do your search. And finally, you do that critical appraisal, whether it's just a quick one or a robust one, but definitely take a look and consider where your information is coming from and what you're going to do with it. Oh, and you might also just, it might just be for your interest. You might have heard about something in the media, said like, I don't really understand what they're talking about. You might just need a couple of things to get you up to speed on a certain topic. PubMed can be really great for that, especially. Yeah, so lots of different reasons to search lots of different places. We've got our contact information, and again, we can pop that in the chat. And we have time now to take some questions. You can use the Q&A if you want, or just in the chat. We'll pause. That was maybe I should have given a warning that the end was coming up and preparing for your questions. I can mention too, in UpToDate, just if you're thinking about questions, maybe I'll just show this quickly here. So back to UpToDate. Sometimes they make recommendations saying, like what was this one here? Here is the vitamin D is estimated as or worldwide people have a vitamin D deficiency between 80 and 98% of pregnant individuals. And if you are looking for a definitive source on that, then you can click on the reference here and it will take you to the reference. And so again, if ever you want the full text of that, you can just, highlight all of this and send it to us and say, I need this information. They also link to PubMed, so I can click on that. It will take me to PubMed. I can read the whole abstract. I can see similar articles, and I can click on the full text. I already know that it's going to ask me to pay money to Elsevier, but again, you can just send us that information and ask for the full text. So that's sometimes when I'm in UpToDate and it includes a statement, and then I say, what is the evidence behind that? I would like to dive deeper into that. You can just click through like that. It's really easy. Okay, so we've got a couple of questions in the chat. Some thanks. So glad, somebody liked the crap test. So glad you like that. Happy to have given you something to take away that you can just use immediately. Question about how to renew library card. Just email MHIKNET@umanitoba.ca and we can get that renewal processed for you. Gail mentioned we often need proof of your ID, but also emailing from your RHA email address is also sufficient proof for us. So just email to Cheryl at the general line and she will connect you. And that was also another update I jotted down for our slides. We've stopped issuing the physical cards, so it's just your library account that you need. You don't need that physical card. Oh, the general email is, I'll pop it in the chat, mynet@umanitoba.ca. Okay, so that is all of our content for today. And we'll hang out for a couple more minutes if you wanted to share any other feedback or ask any other questions. We're happy to take those. And otherwise, it was really great to have you here today. And we hope you have a great weekend. And somebody used an emoji. I was going to, we didn't have those enabled last time. And then I played around with the settings, so they are working. Okay, now we need to, on the new slides, practice doing emojis and ask for thumbs up or thumbs down. Always enable emoji. There are mixed mixed thoughts. There's those of us who use them and love them, and those who are like, oh my gosh, this is distracting. So from the chat, I see you users who are pro emoji. Okay, thanks everybody. We'll shut it down, and again, feel free to message us anytime as you have questions or thoughts, and we will be following up to send you the slides and a handout. Take care.
Thanks, everyone.